Namaste and welcome to another interesting Facebook Live session. Today we'll be exploring a very important topic, breast cancer awareness. We'll be diving into how critical it is to identify breast cancer in its early stages, the latest developments in its treatment, and how can you take proactive steps to safeguard your breast health. And we are very privileged to have not one, but two experts here to discuss this important topic and address all your concerns. Dr. Niveditha Bharathy, Senior Consultant Obstetrician and Gynaecologist at Apollo Speciality Hospitals, Vanagaram, and Dr. Suresh S., Senior Consultant Medical Oncologist, Apollo Speciality Hospitals, Vanagaram. A very warm welcome, Doctor. With their extensive expertise and experience, they'll be providing us with imperative information about breast cancer, giving you all the knowledge that you need to take care of your health. A very warm welcome to our esteemed doctors. The first question is for Dr. Niveditha. We see an increasing incidence of breast cancer today, doctor, in women in a relatively younger age group when compared to the yesteryears. What do you attribute the reasons to this?
Yes, this is the most relevant question when we talk about breast cancer awareness today. So if you look at the statistics, right back in 2008, cervical cancer is the most common cancer amongst Indian women. And in 2012, the statistics say the breast cancer overtook the cervical cancer, but in rural areas, it was still the cervical cancer. But according to the latest statistics, it is the breast cancer, it is the number one cancer even amongst Indian women, both rural and urban areas. There are so many factors that we can attribute to this rise in the breast cancer incidence, as well as the incidence of breast cancer amongst the relatively younger women, say it in late 30s and 40s. So we can attribute it to so many lifestyle factors, like, as you all understand, obesity is on the increase globally and India is not an exception. And the next important factor is women are more career oriented nowadays and they postpone their first pregnancy to a later stage, to the late 30s and early 30s. So that is also one of the risk factors for breast cancer. And as we all know, the girls attain menarche, that is, they start their first periods at a relatively younger age, and women attain menopause at a relatively later stage. So the early menarche and late menopause, that means the amount of number of years of estrogen exposure is more, which is again one of the major risk factors of breast cancer. And of course, everybody will accept that many women are not breastfeeding exclusively nowadays, but of course the awareness is on the increase now, and that is also one of the major risk factors for breast cancer. And also we see more number of cancers in the younger age group.
So, Dr. Suresh, how do we identify the common signs and symptoms of breast cancer, and what should we watch for? Is it age specific? How do we know what are the signs and symptoms, doctor?
Breast cancer can come at any age. Most commonly, the commonest cause for cancer is age. Some 40 years back, the life expectancy of our patients was around 60, but now we are going about 70 and above. So, the older you grow, the more reasons that you can have cancers. The most common symptom of cancer is always a lump in the breast. This can happen anytime, at any age. If it is going to be related to any menstrual period, then it can be something called a fibroadenoma or fibroadenosis, which can be a benign type of cancer, which can be a benign lump. Sometimes this can change and then can have pain. It can rapidly increase in size and also can be associated with a nipple discharge, mostly a blood discharge, and also some excoriation, that's the skin peeling of nipple areolar complex. Some patients can also have swelling in axillary region, that's called the armpit, and these are all early signs of breast cancers. Suppose the patient is negligent, she doesn't pay attention to the breast lump, the skin can get eroded, can come up with a ulceration, pain, and a fungal infection and smell also. And if the patient is getting an distant metastasis like lung, she might come up with cough and breathing difficulty. If it has spread to liver, she can come up with jaundice and difficulty in eating and loss of weight. If the disease has spread to brain, then she can come up with seizures. And if it's going to be to the bones, it can be as a bone pain or a fracture. So the signs and symptoms of breast cancer is not one. Though it might start with a lump, it can have a varied symptoms depending upon how long the disease has been there in the patient.
So that said, the most commonly asked question across the internet is, how can I perform a breast self-exam and how often should I do it? Dr. Niveditha, can you please elaborate on this?
The first step towards reducing the morbidity and mortality because of breast cancer is early detection of breast cancer. Because as abroad, as in other Western countries, still we do not have a structured breast cancer screening program in our country for whatever reason. So what do we have? So first step is to educate women to be breast aware. So they have to know what is normal and when should they seek medical help. So the first step towards it is they should know what is normal for them, because not all the breasts will be the same. So they have to start what we call the self-breast examination right as early as 25 years of age. So when we talk about self-breast examination, what are we looking for? So we are teaching the brain and training our hands to see and to feel what is normal. Then only we can appreciate when it becomes abnormal. So when it becomes abnormal, then you have to seek medical help. So as we say self-breast examination, what is the ideal time to do it? So the ideal time to do a breast self-examination is soon after a woman completes her periods. The reason being, just before the periods, many women do have breast pain, breast soreness. So if they do breast examination at that point of time, they wouldn't do it properly. So the ideal time to do the self-breast examination is soon after they finish their periods. And then how to do it and how to, it is not only feeling the breast, you have to see the breast also. So seeing and feeling the breast, so you will be aware what is normal for you. So there are so many ways and ideal method, the correct method to do and feel the breast also. So you have to look for any changes, that is look for changes. So by looking at the mirror and also feel for changes. When we say feel for changes, what is the commonest thing that any woman can feel is a lump. That is the number one. Number two, any thickening. It's not only a discrete lump. Sometimes there may be a little thickening or little different from what you were feeling earlier. That also should prompt a medical help. The next thing is any discharge from the nipple. So all these things form self-breast examination, and it also includes the examination of the armpit as well. Any swelling in the armpit also has to tell the patient that something is abnormal, so they have to seek medical help at that point of time. So this is all about self-breast examination that any woman should start as early as 25 years of age. So having said that I told you the self-breast examination, the ideal time for a premenopausal woman is soon after a period. Once the woman attains menopause, then she will not be having her regular periods. In that point of time, she has to have a fixed time every month. That is the first week of every month. That is monthly self-breast examination. So that is where we can, because what the statistics say is 50% of the time the breast lump or the breast cancer is diagnosed only after a woman comes to the doctor after feeling the lump. Even though it is not a sensitive method to detect a breast cancer, something is better than nothing.
Absolutely. Dr. Suresh, while talking about the symptoms of breast cancer, you mentioned about a benign breast lump. So how do we as a layman find out the difference between a benign breast lump and a cancerous one?
So, as I had said earlier, uh, benign breast lumps might be the most common rather than cancers. Benign breast lump mostly falls under two categories, that is fibroadenoma and fibroadenosis. This is a small lump which will be there in the breast. It can come after the age of patient attaining menarche, and this lump can be single or multiple. It will be firm in consistency. It will be mobile, which means when you are going to press that, it can move around the breast, and the size will not increase in size rapidly. Whereas a breast cancer lump within a period of months can increase in size. Fibroadenoma will not do like that. The second commonest benign condition is fibroadenosis, where again you will be having a small lump, but it will be very vague. It will not be having a definite borders, and this will have increase in size during pre-menstrual time. So along when there is a menstrual periods, the hormone changes will have an increase in size of the lump along with associated pain also. So this is the most common fibroadenosis type of benign lump. Apart from this, you might have a lump during pregnancy or during lactation also, which will subside once the delivery is done or once you stop the lactation also. So these are the most common benign. Whereas when you come to a malignant thing, lump, it will be always small in size, very hard in consistency, and it will be increasing in size very rapidly. Sometimes it gets attached to the skin or attached to the chest wall, which means then it will not be a movable one. Unlike a benign thing where it can be moving around, a cancerous thing may not move around. So these are the basic differences between a benign and a malignant lesions.
Having said that, when a woman was feeling a lump or is feeling a lump, the best way to go and see the doctor, even though Dr. Suresh has beautifully said how to differentiate between a benign and a malignant lump, not all breast lumps are cancer. But at the same time, it is better not the patient themselves to come to that conclusion. It is always better to seek medical help, to see the medical doctor, because our hands are a little more sensitive than the patient hands. Even though we feel it and we can come to a conclusion whether it is a benign or malignant, it has to be investigated appropriately and said that it is only a benign. So it is better not the patient themselves to decide whether it could be benign or malignant. Once they feel a lump, it is always better to seek medical help to see whether it is this way or that way.
So in continuation with what Madam has been saying, apart from self breast examination, which should be a monthly, you need to consult a physician also once in a year. Even if you are going to be a normal person, check your breast with a physician, because his hands are sensitive. He might be paying more attention to your signs and symptoms.
So, Dr. Niveditha, are there any lifestyle changes or habits that women can inculcate or change in themselves today to help reduce the risk of breast cancer?
Yes, of course. For any cancer as like that, breast cancer also has got some risk factors. As I told you, when we talk about risk factors, we always divide them into modifiable and non-modifiable risk factors. So non-modifiable risk factors are something like age, sex, race, ethnicity, which we don't have any control over and which we cannot change. So only thing, when we take a family history, we go through all this and then decide the risk factor for that particular patient. When we talk about modifiable risk factors, which are mostly in our hands, like obesity and postponing the first child and breastfeeding adequately for each child, all these things are modifiable risk factors, and taking hormone therapy under supervision, because unsupervised hormone therapy is again one of the risk factors for breast cancer. So all these things are modifiable risk factors which we have control over, which have to be paid attention to reduce the risk of breast cancer. Having said that, breast cancer, it cannot be prevented to a larger extent except for a small group of patients who have a genetic predisposition to breast cancer, where they undergo what we call prophylactic mastectomy. In the sense, if those particular patients are diagnosed with a particular gene mutation called the BRCA1 or BRCA2 and other gene mutations as well, they go for prophylactic mastectomy, meaning in the sense once they reach a particular age and once they finish their family, they are advised to go for removal of the breast. Only in those patients we can talk about preventing the breast cancer, not in other patients. And that subgroup of patients anyway form a very small percentage of breast cancer, say about 5 to 10, less than 5 to 10% of the cancers. The rest of it, what we can do is we can detect it early. That is the step. That is where we talk about self breast examination, where the woman does examine the breast herself. Second is the clinical breast examination, where the doctors perform the breast examination. Third comes the mammography and the other imaging modalities, including the MRI.
Dr. Suresh, talking about predisposed family conditions, what Dr. Niveditha was talking about, is family history actually a significant factor in breast cancer risk? And what do I do as a patient or as a person if it actually runs in my family? And how do I identify my previous generations as well?
Okay, so when you
Long
ask
question,
this,
sorry.
no, when you ask about family history, whenever a patient comes to me, the first question they ask me, sir, is this in my family? And if it's so, I don't have any of my ancestors having this. So what I tell them is only few cancer are hereditary cancers. One among the cancers which can come by hereditary is breast cancer. So we need to talk with the patient and get to have at least 3 generations of family history from their father, mother, grandfathers, and grandfathers and mothers. So we need to have a family pedigree chart and then say who have had breast cancers and any other cancers. It's not that only breast cancer alone means you can have a high risk of cancer. Suppose the family history has got an ovarian cancer, a male breast cancer, patient having a prostate cancer. So if any of these family members has got this hereditary cancers, then this patient can have a high chances of a familial cancer. But if a patient, 100 patients comes to you with a breast cancer, it is very negligible. As Dr. Niveditha has been saying, only less than 5% of the family patients will be having a family history of breast cancer. 95% of the other cancers come out of the blue because of environmental changes, because of their lack of exercise, because of their excessive hormonal influence. So these are all the most common cause for breast cancers. So 95% comes away from genetic factors. So whoever has a genetic factors, we have to sit with them, take a pedigree chart, see what are all the cancers the family history has got. If the family history is suggestive that this patient can have a cancerous trait, we can go ahead with some genetic tests. The most common genetic test which we do is, as Dr. Niveditha was saying, a BRCA gene testing. This BRCA gene testing is a very simple blood test which can be done from our peripheral blood, and the results can be obtained within 2 weeks. And if it is positive, then the chances are it can be a familial. And if you are turning to be a positive cancer, your mother and your siblings also can be tested for BRCA gene, and if they have, then prophylactic treatment can be done for them also.
I'll take this question with both of you. It's a common question. A gynecologist is the first point of contact when a person is diagnosed with breast cancer. How do you handle your patients, number one? And what are the options as a breast cancer patient receives for diagnosis basis? That will be for you, doctor. Could you please elaborate, both of you?
Because being gynecologists, we are the first point of contact for women, not only for breast cancer, for any other problem for that matter. So in that case, once we do a physical examination, we confirm that it is a lump. and then we have to confirm it radiologically, that is by imaging. And the most common form of imaging is mammography, depending on the age group of patients. Usually mammography will not be sensitive to pick up a cancer in a younger age group because the younger breasts are very dense. So mammography can still miss some of the lesions. But at those situations, we do other forms of imaging like MRI. So once physical examination is over and we suspect a malignant breast lump, then we go on further with the imaging to confirm the diagnosis. That is number one. So number two is, once the mammography says that it is a suspicious lesion, then we have to have a tissue diagnosis by way of doing a biopsy. So once that is confirmed, then we have to, that will tell us the type of cancer and how aggressive it is. And next comes the staging of cancer. So staging meaning whether the cancer is confined to the breast or it has spread elsewhere. So based on which the treatment modality differs. If it is a very localized cancer, we have what we call breast conservative surgery, and if it is an advanced cancer, we have other modalities also coming in like radiotherapy and chemotherapy, for which Dr. Suresh is the expert to talk about it.
So, when the patient comes with a lump, the most common investigations which we order is a mammogram. So, mammogram, as ma'am has been saying, it can be of two types: X-ray mammogram and ultrasound mammogram. X-ray mammogram is done for patients above the age of 40, and if it's going to be less than 40 years, we do an ultrasound mammogram. Suppose if the family history is high, patient is very young, then ultrasound mammogram and X-ray may not pick up, wherein we have an MRI mammogram. This is very, very sensitive, and they have something like a choline peak, and we have some electrolytes modifications study done which can say whether the patient has got a high risk of cancers in this patient. So you have three types of imaging: MRI, ultrasound and X-ray mammogram. So as ma'am has been telling, once the patient comes to a gynecologist, after the biopsy is done and the cancer is confirmed, patient comes to us. The first thing is, why should I get it? Why did I get it? So these are the two things which the patient will ask. The answer to that is very, very difficult. If we say patient is very elderly, then the risk factors being the age is the most common thing. But if it's going to be a young female, then genetic cancers and hormonal changes might be the reason for this. So when we discuss this, then we do a biopsy and also do a hormone test, something called estrogen receptor, a progesterone receptor, HER2 new receptor. So these are the three receptors which will give us a clue what has been the reason behind the evolution of this study. This is both prognostic and also a predictive factor. Suppose the patient is got hormone positive, these are the subset of patients who will respond very well to treatment, and the treatment has a very good control rate. Suppose the patient is got HER2 positive, then we have a targeted medicines, we can treat them, but also at the same time they have high chances of recurrence. There is a third category of patients where all the hormones ER, PR, HER2 all are negative, which we called as a triple negative, which means we don't have a target to treat them. And these are the patients who will come back fast with recurrence. So depending upon this, we will be tailoring our treatment, the medicines according to the hormone status. After that, we will do a PET scan. The PET scan is mainly done to stage the disease. Staging for all purposes is to determine what type of treatment is best for this particular patient. If it is going to be a stage 1, we can offer them surgery, either a removal of the entire breast or go with a breast conservative surgery. Suppose if it's going to be stage 2 and 3, which means a single modality of treatment may not be enough. The single modality of treatment is surgery followed by adjuvant. which means after the surgery or before the surgery, we will be giving chemotherapy and radiotherapy. And if it's going to be stage 4, which means the disease has spread from breast to other parts of the disease, which I have already mentioned about the symptoms. There we need to give chemotherapy according to the hormone status. So this is the broad outline about the treatment.
So, doctor, what are the potential or are there any potential long-term effects of breast cancer treatment and how can they be addressed, Dr. Suresh?
So breast cancer, see, we'll be very happy now because patients with breast cancer are going to live longer now. Initially, it was very pathetic situation some 40 years back. Now, with the advance in treatment, we are having patients who are going to live long. 10 years, 15 years is the norm now for most of the patients. Not that every patients are going to live, but especially if it's going to be hormone positive patients, they are going to have a very good survival rate.
Having said that, it is not only that, now we are having patients who are diagnosed with breast cancer at a younger age. After, if they are detected at a very, very early stage, they undergo full treatment and they undergo full remission, following which some patients, they also have their babies. So
That's amazing.
that's amazing, and that is how the treatments are well advanced and very effective as well.
So coming to chemotherapy, the complications which you asked, the complications of chemotherapy can be divided into temporary complications and permanent complications. 90% of the complications are temporary, which means only during the treatment you have those complications, and once you stop the treatment, the complications are going to get reversed. Permanent complications like cardiac pumping issues and weakness in the brain and all this will be hardly perceived in 10% of the patients, though it not be fully blown. Some patients can have it, and those long-term complications also can be solved.
So we'll take some questions from our viewers. Uh, Dr. Niveditha, my wife is concerned about breast cancer risk during pregnancy. She is pregnant right now. Are there any precautions that she should consider?
So, pregnancy as such is not a period where one should worry about getting breast cancer for the first time. Suppose if she has got a lump earlier, like a fibroadenoma, which is a benign lump, which can grow bigger because of the hormone changes during pregnancy. If it was confirmed by ultrasound and a tissue diagnosis that it is only a fibroadenoma, then no need to worry about that. Because we have to adequately counsel that woman, that fibroadenoma will increase in size because of the hormone changes during pregnancy. Other than that, one need not worry that pregnancy as such a condition is a high risk factor for getting breast cancer for the first time.
Dr. Suresh, we have a question. My aunt had a lumpectomy for breast cancer. Can you please explain the difference between lumpectomy and a mastectomy?
Yeah. So lumpectomy means it's just removal of the lump alone, whereas mastectomy means you remove the entire breast. But when do you do a lumpectomy in a cancer patient? Suppose the cancer patient is having an early disease, say some T1, T2 with no nodes. So then these patients will undergo removal of the lump along with a good margin of normal breast tissue, and also will undergo a sentinel lymph node biopsy of the armpit. So this is what we called as a breast conservation surgery. Suppose the patient is not willing for that in a very early stage, we remove the entire breast along with removal of axillary pad of fat, that's the armpit. We call it as level 1 and level 2 axillary lymph node removal. Then it is called a mastectomy.
We have one more question, Dr. Suresh. My friend had a benign breast lump which was removed. Is she at an increased risk of developing breast cancer in the future?
So it all depends upon what is the benign lump she had. So we need to see the lump biopsy. If it says something like fibroadenoma and fibroadenosis, we would say that the risk of cancer is very, very less. But because she had some lump, we always need to put her on a continuous screening program with a mammogram.
Dr. Niveditha, My niece is undergoing chemotherapy for breast cancer. What are some of the ways that I can support her emotionally, physically during this challenging time?
So many a times when any patient is advised chemotherapy, the immediate worry is whether they will lose their hair, whether their skin will undergo some changes, will it grow back. All these are some of the common things people do have. So, first and foremost is we have to give her the support and the correct information that not, and many times they don't differentiate between going through a chemotherapy or a radiotherapy. So radiotherapy treatment will not be associated with hair loss and the skin changes, but skin changes do occur only locally where the radiotherapy is given. Whereas with chemotherapy, only all these hair fall, all these changes will do come. And we have to reassure them that it is only a temporary phenomenon. Once the effect of the drug goes away, all the hair will grow back. And for the amount of relief and the amount of disease that is being controlled with the chemotherapy, it is worth putting up with that temporary hair loss. So that is where we can give them the support. So it is not going to be a permanent thing. It is only a temporary thing. And the most important aspect is we have to control the disease. That is the primary thing.
While emotionally supporting them as well.
Definitely. Now we have cancer support groups where they can meet people who also have undergone the same treatment, same disease process, and that also will give them the reassurance and the courage to go through the treatment. And there is no point in not telling them the truth and the facts. And the most important thing is we have to tell them what they should expect. And everybody knows that going through cancer treatment is not a simple thing. At the end of the thing, you may be out of disease free, but going through the treatment definitely carries a lot of courage from their side. So we have to give them the correct information, what they should be expecting. So if that is there, then they will be accepting it well. So that way the support groups and talking about the facts to the patient carries an utmost importance.
So, what would be your message, doctors, for our viewers watching this session today? Dr. Suresh, we'll take it from you.
So, breast cancer is a curable cancer if found at very early stage. And we are going ahead with our treatment options. Like most commonly, I will be speaking on chemotherapy because if you are going to have a hormone positive, we have something like hormone sensitive treatment, hormone like tamoxifen, letrozole, aromatase inhibitors, and all the things. We also have an latest modifications like CDK4/6 inhibitors, which has changed the entire stage 4 hormone positive breast cancer. We are having patients who are having a very good response rates and they are having a good quality of life. Similarly, if the patient has got an HER2 positive, we have a targeted treatment against that like trastuzumab, pertuzumab, and also a combination of trastuzumab and pertuzumab which can be given as a subcutaneous injections. That means you don't need to get even admissions. It can be given as a subcutaneous injections. Suppose you don't have all these targets, hormones or HER2. We have a triple negative breast cancers. Now we have the latest immunotherapy which has been approved in this breast cancer. So the treatment armamentarium has improved a lot, which means the response also is going to be having a very good future.
Dr. Niveditha, what would be your message for our viewers today?
So as Dr. Suresh said, breast cancer nowadays we can talk about cure provided we detect it early. So we cannot prevent breast cancer 100% like cervical cancer because we don't have a vaccine against it till today. So the first step is all women have to be breast aware. So they should know how to do a self breast examination, and then only they should know when to seek medical help. So the early detection and appropriate treatment goes a long way in preventing and reducing the mortality and morbidity because of breast cancer. Even for advanced cancer, we have now new therapies, as Dr. Suresh said, that the targeted therapies and the immunomodulators nowadays to to reduce the morbidity and mortality from breast cancer.
Thank you very much, doctors. It was a very enlightening
Thank you.
experience for us to hear from the experts. For appointments with Dr. Niveditha Bharathy K, Senior Consultant Obstetrician and Gynaecologist at Apollo Speciality Hospitals, Vanagaram, and Dr. S. Suresh, Senior Consultant Medical Oncologist, Apollo Speciality Hospitals, Vanagaram, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, doctors. Thank you, viewers.